Retirement Subcommittee meeting. This is the low-key day, meaning we're not taking any votes, but we've got some very important information that's going to be shared with us, first from VRS and then from DHRM. And with that, we will turn it over to VRS.
Well, thank you, Mr. Chairman, members of the Commission. I'm Trish Bishop. I'm the Director of VRS. We greatly appreciate the opportunity to be with you this afternoon to provide you an update on the system. So just walking through what I plan to cover, we'll talk about funded status and contribution rates, investments. We'll take a deeper dive into the hybrid retirement plan. We'll also touch upon the results of a work group that we participated in the interim related to the judicial retirement system. I do have at the end of the presentation as an appendix, fear not, I will not go through every bill with you, but just for your reference, I've included legislation that we had, I think it was Friday night, was through Friday night for all the legislation related to VRS. So let's go ahead and get started. This slide presents our mission statement to deliver benefits and services through sound financial stewardship and superior customer service. We take pride in serving those who serve others and helping our members plan for tomorrow today, and we take this job very seriously. We are the 14th largest public pension plan in the U.S. and the 36th largest in the world, and we serve about 830,000 members, retirees, and beneficiaries. When we think about service delivery, we participate in a benchmarking service that compares opportunities for us to further improve service and reduce costs, and compares us to other retirement systems across the country and around the world. When we look at our service score, we're aligned with service across our peers, but importantly, we do so at considerably less cost per member. We're about 30% below the cost of our peer retirement systems. So this graphic shows, as that yellow arrow points to, that we are in the high service, low cost quadrant compared to our peers. So Michael asked us to talk a little bit about membership, and this slide shows you the various plans that we administer and the number of individuals covered by each of the plans. You'll see that our teacher group, which is the top line here, is our largest group with about 156,000 teachers covered by VRS benefits. You'll also notice in the third column under the hybrid plan that the largest active member group is the hybrid retirement plan. You'll also notice in that column, in the hybrid retirement plan column, that state police and Valors are not included in the hybrid retirement plan. Neither are employees of local governments who are who have enhanced hazardous duty benefits. So currently, the hybrid is now our largest active member group. Just looking at our active membership over time, this shows you that the state group, which is sort of a bluish line on the bottom, has remained relatively flat over time. However, this doesn't include the folks who are in the optional retirement plan for higher education or the optional retirement plan for political appointees. So that's another about about another 19,000 folks who wouldn't be on this particular slide. We also have the localities in aggregate. Those are in green. And then the yellow line represents the teacher population. And that is starting to trend upward after a period of being relatively flat post the Great Recession. This slide shows you the trend lines related to the various plans that we serve. Again, the blue is the state employee group, green is the political subdivisions, and yellow is the teacher retirement plan. That is our largest plan, so it would make sense that the teacher group has the largest number of retirees. So I'll pivot now to our investment program. It may be worth noting that 2/3 of benefits are funded by investment income. So 1/3 is the employer and the member contributions, but 2/3 are those investment-generated dividends and returns that our team achieves. So it's an important part of the funding mechanism for benefits. You'll see here on this slide the value of the fund over time, and the good news is that it's been on an upward trajectory. Returns were a little bit muted in 2022, they improved in 2023, and then at year-end fiscal 2024, you'll see that the value of the portfolio reached about $114 billion. This shows you the fiscal year-end returns. Those are the big dark green bars. The light green line that is across this table relates to the long-term assumed rate of return, which is our discount rate, how we get to the present value of our future liabilities. And so we use a 6.75 discount rate. So in any given year, we may be above or below that assumed rate of return, but over the long term, our goal is to be in excess of 6.75%. Last year for 2024, we had a 9.9% return net of fees. And this compared favorably to other public plans across the country. So I'll pivot now to plan health and funding, including funded status and the employer contribution rates. But just by way of background, funded status is a measure of financial health for the plan. It represents the percentage of the plan's future benefit obligation or liabilities that are covered by our current assets, that trust fund value that I just showed you a moment ago. The liabilities are the total amount we expect to pay out in retirement benefits to our current and future retirees. In other words, funded status is the ratio of assets available in the trust compared to the present value of the promised benefits to our current and future retirees. When we look at first the state employee plan, we are at about 82.1% funded. That's the blue bar. The green bars are projections. And as you can see, over the last 5 years, funded status has generally improved. However, and I think importantly, and I'll touch on this a little bit more in a minute, we still have about $5.4 billion on a market value basis in liabilities that remain. So we've made progress, but there are liabilities that remain. A similar story here for the teacher plan. The teacher plan as of June 30th, 2024 was about 83% funded. Again, same trend roughly as the state employee plan, but here as a larger plan, there's about $10.7 billion on a market value basis in unfunded liabilities that remain in the teacher plan. So we're often asked about how we compare to other states with respect to funded status. And this has been an area of interest for bond rating agencies. So this chart uses 2023 data, which was the most recent data available. And as shown here, you'll see in the yellow line, it's a little hard to see if you're in the audience, but VRS is in the upper quartile. But if you look at that green line, that relates to the long-term assumed rate of return that the plans use. So if we had normalized the long-term assumed rate of return and everybody used 6.75% like we do, VRS would move up in the rankings there. In fact, only 3 of the plans who have a higher funded status than VRS use a discount rate at or below what VRS uses. Similarly, this is just the AAA states. So again, it's the same narrative that VRS is the yellow bar. Tennessee and South Dakota use a lower discount rate, but everyone else uses a higher, those that are above us use a higher discount rate. Again, if we normalize that discount rate, we would move to the left on that table. So I told you we'd touch a little bit more on the unfunded liabilities related to each of the plans. This slide gives you, it's a lot of numbers, but it gives you for each plan the unfunded liabilities in each, as well as its funded status. And so across all the pension plans, it's about $20 billion in unfunded liabilities across all the plans. So when we think about the plans and we think about making any plan design changes, it's always important to be mindful that we're still paying off that those unfunded liabilities that exist. This is a similar table related to the other post-employment benefits. Other post-employment benefits include things like group life insurance and the health insurance credit. These plans are not as well funded as the pension plans, and in part because GASB didn't require, the Governmental Accounting Standards Board didn't require pre-funding as early in the OPEB plans as they did in the pension plans. And so they're kind of still getting up to speed. But you'll notice here that, for example, the health insurance credit for state employees and the health insurance credit for teachers are 35%, 36%, and 22% funded respectively. So there's a lot of ways to go to get them sort of to a healthy, to a healthier status. And so we appreciate the infusions that you made in prior session to help reduce those liabilities in those plans, and that has improved their funded status. Just providing the various employer contribution rates that are in place presently, and they're listed here by the various plans we administer. One thing to note is that each year we do an actuarial valuation of the plans and develop contribution rates, but we only use them every other year for rate setting purposes. So this year, the 2024 valuation was just done for informational purposes. However, it kind of gives us some insights into where things will be headed going forward. And it looks as if that things are pretty stable for both the pension and the OPEB plans. And in fact, in some cases, there was a little bit of a dip in the rates. So I think we're moving to a pretty steady state on contribution rates. As I noted, this table provides you the contribution rates for the employers for the other post-employment benefit plans. So just kind of giving you a summary on this, that overall and looking forward, rates are generally stable and we expect them to remain so, assuming that all of our assumptions are met. Recent infusions and maintaining higher contribution rates have really improved plan health as well as improved funded status and also generated longer term savings for the plans. Very meaningful positive steps have been taken, but unfunded liabilities remain. And then just to circle back to the hybrid plan, it does use a shared risk model. It serves to lower future employer benefit costs. It does provide increased portability for employees, but many participants aren't making voluntary contributions. So we're going to take a little deeper dive into the hybrid retirement plan to give a little bit of insight there. The hybrid retirement plan is different from the legacy plans that we administer. Plan 1 and Plan 2 are pension plans or defined benefit plans. The hybrid retirement plan combines elements of a defined benefit or pension plan and a defined contribution or a 401k style plan. So there are two parts to this particular plan. So if you're a member in the hybrid retirement plan, in order to generate the same level of income replacement that you would have under the previous pension plans, you have to make more contributions and you have to make more voluntary contributions to make that happen. This just gives you a snapshot about the hybrid retirement plan membership. The teachers are the largest group of hybrid retirement plan members, but they are also tend to be younger members and also with less service because new hires go into this plan. And their median salary is a little bit lower than the average of all employees. So this kind of chart gets to the heart of the voluntary contribution challenge. In the lighter blue bars, you'll see a percentage, and those are the folks who are not making any contributions. And it's divided by, on the left is school divisions, in the middle is political subdivisions, and on the right is state agencies. And so 33 to 36% of employees who are in the hybrid retirement plan are not making any voluntary contributions. Now, we get at this to some extent by one of the plan features that already exists, which is auto-escalating them every 3 years. But auto-escalation is only 0.5% each time. So it would take them about 27 years to get to the full contribution in order to maximize their voluntary contributions and get the maximum employer match for that. So we really keep a very close eye on this, and we think that tools and education they all help, but automatic features can be the most effective. This chart just gives a different look at the same sort of story related to voluntary participation in the hybrid retirement plan. And so the sort of seafoamy bluish green is about 35% aren't making any contributions at all, and then only about 19% are making 0.5% contribution. I guess the good news story in this pie is about 28% of folks are making the maximum. But we have more than half of people who are making 0.5% or less in voluntary contributions. And what that means is going forward, their income replacement at retirement will be considerably less than those who were making those maximums. So in previous sessions, there have been several plan modifications that were suggested. They included accelerating auto-escalation instead of every 3 years, perhaps doing it more either every year or every other year. Also, auto-enrollment has been suggested, and so auto-enrolling folks into the voluntary contributions so that they can take advantage of those employer matches. For example, the state of Georgia auto-enrolls their folks in their hybrid plan, and they do so at the full max and then have an opt-out. Or changing the allocation of the member contribution from how much has to go into the DB plan to putting more into the defined contribution plan. So those were some ideas that had been floated in the past to help get at the voluntary contributions for hybrid retirement plan members. So I'll just pivot now to, this is just sort of a public service announcement. We have changed record keepers for our defined contribution plans. We used to have Mission Square. We went through an RFP process and Voya was selected. So effective January 1 of this year, Voya will serve as our record keeper for our defined contribution plans. Record keepers, basically, they do the phone center, they do statements, they do websites, they do tracking the gains and losses, communications, and distributions. So this slide shows you a little bit of, gives you a snapshot of who got transitioned from Mission Square. We had about 643,000 accounts, about 350,000 unique participants, and about $8.7 billion in assets moved from Mission Square to Voya. But nothing has changed for the participants with respect to their investment lineup, which is what VRS manages. So I'm going to just turn now to the judicial retirement system. We were asked in the 2024, after the 2024 session, to do a working group, which included House Appropriations Committee staff, Senate Finance and Appropriations Committee staff, and the Office of the Executive Secretary of the Supreme Court. The goals were to look at hybrid retirement systems in other states, to look at the hybrid retirement system, the impact it might have had on judicial appointments, and then also to develop some options for modifying the current structure for judges and include some cost information related to it. Just by way of background, Judges, just like everyone else who are newly elected or appointed, move into that plan, into the hybrid retirement plan. And just JRS, just like all of our other plans, has gone through the same reform changes over time. And so, so if you were a new judge, regardless of whether you had prior service, you would go into the hybrid retirement plan. So one of the reasons I think that JRS moved into the hybrid retirement plan was, as you can see here in sort of the blue line, which is what the calculated cost of the benefit was, it was approaching 60% of pay. Following the implementation of the hybrid retirement plan, we're now at about 31% of pay for the rate for judicial retirement, the judicial retirement plan. The funded status of JRS is listed here, and you can see that funded status has been improving since the implementation of the hybrid retirement plan. The green line here shows what the state employee plan's funded status is compared to the blue bars represent the judicial retirement plan. One thing that is unique compared to other states in the judicial retirement system is the notion of weighted service. And over time, that weighted service has changed. So if I were a judge elected between 1970 and 1995, for every year I'd work, I'd get 3.5. If in 1995 through 2010, for every year I'd work, I'd get 2.5 years of service. On or after 2010, there was a schedule related to age. So if you were appointed before age 45, you'd have 1.5 years of service for every year you worked, 2 if you were 45 to 54, or 2.5 if 55 and older. This shows you the judicial retirement plan compared to folks who were in Plan 1, Plan 2. On the right side, the bars, those relate to folks who, if they make the minimum in the hybrid retirement plan, or if they make the maximum, which is the far right. On the top of the chart shows people at age 40 and retiring at age 65. The next one is if they start at age 50 and retire at age, 73 is the second one. And then the next one is down at the bottom left, which is what I'll focus on next, is for folks who were appointed at age 55 and retired at age 73. And because they have a shorter period of time to generate investment earnings in the DC portion of their plan, their benefit is generally not as robust as folks who were hired at earlier ages. So we were asked to come up with some potential options. We used some of the previous legislation that had come through to help inform the options that we provided. The first one is just to increase the defined contribution employer match for JRS hybrid plan members to 100% of their contribution. So instead of 2.5%, make it 4%. The second option really focused in on that group of who is 55 or older. Those were previous legislation focused on this particular group, and there's another bill this year that does as well. And this one gives them a 1.1% multiplier instead of a 1% multiplier that exists in the hybrid. And so that would get them to roughly what a Plan 2 person would have in terms of a benefit. The third option was a 2.75 service weighting, and again, that would get them to essentially a Plan 2 benefit. And lastly is just to move all of the judges prospectively from the hybrid to Plan 2. So from a cost, investment risk, and administrative feasibility standpoint, making changes on the defined contribution side has fewer impacts than making changes to the defined benefit plan. And this table walks you through what those various options would do. In the third line of the table shows you the various cost impacts to what the rates would be. So ranging from about a little more than $1 million to considerably to about $4 million in additional dollars. And it will continue to increase going forward as more newly hired folks go into that plan. So contribution rates remain generally stable. Recent infusions and maintaining the higher contributions have really helped improve plan health and generated savings. Meaningful steps have been taken, and we're gratified for your efforts in that regard. But again, unfunded liabilities remain. So as we think about additional enhancements or changes to the plan, being mindful of those unfunded liabilities. Hybrid does employ a shared risk model, and it was designed to lower future employer benefit costs, but there may be some opportunities at some point to improve outcomes with some potential plan design changes if resources were available. And lastly, Voya Financial has succeeded Mission Square as our record keeper for the VRS defined contribution plans. So with that, that concludes my prepared remarks, but I'd be happy to take any questions.
Trish, thank you so much for that's always helpful, always super informative. See if we have any questions. I had one for you, just going back to, well, first of all, I'm glad to see the contribution rates on a good trend line. How do you judge, or how do you measure now the overall participation rates? Like for teachers, or most, I'm just doing some quick math, but it looked to me, based on your enrollment numbers, most teachers in Virginia, public teachers, are enrolled. Is that a true statement?
Yeah, so all of the Commonwealth teachers are members of the Virginia retirement system, even if their particular locality is running their own system. So for example, Fairfax teachers are covered under VRS, even though Fairfax County runs its own system. So all teachers are in. And then support personnel within school divisions, they are in separate plans that are in the political subdivision part of the plan. And so those include cafeteria workers, bus drivers, and other support personnel.
Okay. So it's fair to say, I mean, people are being enrolled, so that really the question is how in are they in terms of what they're contributing in?
Yeah, so we spend a lot of time trying to work with our employers to use communications, education, tools, on the website, things like, yes, I want to save more, kinds of splash screens that come up, or don't leave money on the table, those kinds of messaging. But to be honest, I think sometimes the automatic features work the best. When they're auto-escalated every 3 years, less than 1% of participants opt out. So you kind of take advantage of general inertia, which is to their benefit.
That's great. Any other questions? Trish, thank you so much. Sure. Really appreciate that.
My pleasure. Thank you.
Okay, we're going to do a pivot to DHRM. Since we get a presentation swap up here, we've got Director Janet Lawson coming up.
Good afternoon, Chairman Willett, members of the committee. Thank you so much for having me today. I'm honored to be here and provide an overview of the Commonwealth's workforce. And I don't see the presentation up. I don't know if you all have it on your screen. You do? Okay. So our agenda today, I'm going to cover some of our, there we go, our workforce statistics and trends, a compensation update, and then I was asked to provide an update on our health benefits plan, specifically our health insurance fund, a status of our procurement, and then kind of pivoting to workers' compensation and post-traumatic stress disorder claims, and some key messages to wrap up the presentation. So for our workforce, so this slide should look a little familiar. The next few slides should look familiar. So this is a composition of our entire workforce, every branch of government, both classified, wage, faculty, et cetera. So at the end of fiscal year, for fiscal year 24, so at the end of the year, we ended with about 136,955 employees. Collectively, overall, 56,917 are classified. So just keeping in mind that for DHRM, most of our programs, our policies cover those under the Virginia Personnel Act, which would be your classified employees. We did see a slight increase over last year this time. June 30th of 23, we were down about 4,000 employees from where we ended in 24. This next slide kind of breaks down our employees, our classified and wage employees by all 4 branches. So you can see the numbers there and the percentages. And then you can also see that the majority of our classified staff are in the executive branch, as we would expect. So our next slide has to do with the demographics of our classified workforce. Overall, we didn't see much change, especially with the average age of our new hires. Our diversity did change slightly. We did see an increase by 4% of our minorities, and a decrease of 4% with our non-minorities. And then this next slide shows the top 10 agencies and job roles. You'll notice that of those 10, 3 of agencies are in public safety, 3 agencies are in health and human services, 2 agencies in transportation, and 2 are in education. And just a reminder that in education, we see a lot more non-classified or faculty and administrative staff. So our next slide shows some recruitment and retention statistics. Overall, our vacancy and turnover rates are up about 2% over the prior fiscal year, but still within our expected ranges. We also noticed an increase in promotions and transfers, an increase from the prior year, about 15%. And our retirements and retirement eligibility rates are mostly unchanged from fiscal year 23. And this next slide shows a 5-year trend of our turnover rate, and you'll see we are, again, slightly ahead of where we were when we ended fiscal year 23, but still lower than the other prior years. So telework is always a topic of conversation. We just wanted to provide a comparison from fiscal year 24 to fiscal year 23. Again, pretty much unchanged. I think we saw an increase of about 1% for both eligible employees to telework, as well as a 1% increase in employees actually teleworking. Yes?
Question for you. For teleworking, is that 5 days a week or 1 day a week, or you count it? How do you count who's teleworking?
This could be anywhere from 1 day to 5 days. We can provide a breakdown by how many days per week. If that is desired, we can certainly provide that in the next day or 2.
I'd like to just send it to me.
Okay, can certainly do that, Mr. J. All right, pivoting to compensation. So this next slide, it's a little busy. But this shows a breakdown of the salaries of our classified staff by pay band on the top right, as well as on the left, you'll see our lowest paid staff, our highest paid staff, how our salaries compare to the federal minimum wage, as well as Virginia state minimum wage. And then the chart at the very bottom shows a comparison of the salaries of our employees in the Northern Virginia region compared to statewide. I know it's a lot of information. So for pay increases, wanted to show this chart that since 22, we have seen collectively a 15% increase in pay raises for all of our employees. So that would be, if you broke it down, a 5% increase July of 22, a 2% increase December of 22, a 5% increase June of 23, and a 3% increase June of 24. Compared to our private sector peers who had an average of 12.3% during the same time period. I will say that this 15% compounded increase is helping us close the gap of our average salaries compared to the private sector. 10 years ago, my predecessor reported that on average state salaries lagged the private market about 25%. As of the end of 23, when we had our last biennial compensation report, we were down to a 13% lag. And I will state that we do have employees that are paid at or above market. So when we say that we lag the private sector, again, keep in mind that's an average. This next slide shows a 22-year distribution of pay increases. And the purpose of this chart is really to show that pretty much every year in the past 22 years, the private sector has provided some form of pay increase to their employees, whereas the Commonwealth has had years where we've provided no pay increases. And then after a few years, we'll provide a couple of years of pay increases. So that has contributed to some of the lags between the Commonwealth salaries and the private sector. But again, the last 3 years are helping us close that gap. And then just to remind everyone that we do have a 3% pay increase that is projected based on the biennial budget that we're currently in for fiscal year 24 to 26. In our private sector peers, based on some study or some research that we have conducted, we're seeing an average of 3.7% for the private sector. So just some information to share with you. We have partnered with Deloitte to conduct a review of both our salary structure as well as our job architecture. Our salary structure, actually both of them are at least 25 years old. For those of you who've been around since the late 90s, you might recall when we went through what we call comp reform, where we took about 23 pay grades and condensed them into 9 pay bands. That model was popular for about 10 years, but it is no longer what most employers use. So we've asked Deloitte to help us see, what should we be looking at when it comes to our salary structure. Same thing with our job architecture, with our career groups and occupational families. It's a dated model, so again, we've asked them to help us look at what are some alternatives that we think would help us be more competitive. We will also be conducting our next biennial compensation review this year with a report due out, I believe, in September. And just to wrap up compensation, so 2 things around compensation. So you may or may not recall that the Federal Fair Labor Standards Act had an increase in the salary exemption. So for those individuals had a salary, floor of you had to earn a certain salary in order to be exempt from overtime pay. July 1st, that increased, and there was a proposed increase for January 1st of 25. In November, the courts vacated that proposed overtime rule. Of course, it still is not final. We're still kind of watching to see what happens with that. Virginia minimum wage also increased from $12 to $12.41, effective January 1st. We had been working with our agencies since August to make sure they were aware of the change and make sure that they were not just in compliance, but we didn't have any staff come January 1st that were below that new threshold. So now I'm going to pivot over to health benefits. So just a quick overview. Yes.
Hold on 1 second. I missed a question from Delegate Reed.
Yes, thank you, Mr. Chair. If we could go back to slide number 16, where you were talking about compensation review and how we had gone from multiple pay levels to 9 or so pay bands, and now
yes.
What's the predominant way that industry is looking at doing pay now? Is it more granularity, or are we looking at going back to where we had 23 different things, or fewer? What's kind of the state of the art right now?
Mr. Chairman and Delegate Reed, thank you for the question. We are seeing more granularity where there's more pay grades. Some employers actually have what we call the old step and grade system, but collectively we are seeing more pay levels, if you will, versus fewer.
Thank you, Mr. Chairman. Thank you, Janet.
All right. Great question. Oh, and I went too far. Okay, so health insurance. So So the first slide is really an overview of the state health plan. So the Office of Health Benefits resides in DHRM. Currently, for the state plan, we have roughly 207,000 members. So this includes employees, it includes their spouse and dependents. It also includes our non-Medicare retirees and their dependents. Within the state plan, we have 5 medical plans, health insurance plans. We have 3 statewide and national plans that are self-insured, and we have 2 regional plans that are fully insured. All of them come with a basic dental coverage. In addition, we have optional coverage for expanded dental, vision, hearing, and out-of-network coverage that's available for most of our plans. One point to note is that on average, the Commonwealth contributes at least 88% of the full premium to all of our plans. So whether you have employee-only coverage, employee plus one, or family coverage, the Commonwealth is contributing 88 to 90% of the premium cost. How this differs from the private sector and even many public sectors, local subdivisions, political subdivisions, most of those employers will contribute 70%, some of them as little as 50%, especially for family coverage. Office of Health Benefits also manages the local choice, which is an optional plan for our political subdivisions. Currently, we have roughly 350 political subdivisions. This would be local governments, school divisions, boards and authorities that have opted into this program. We have two self-insured plans and 2 fully insured plans, those 2 regional plans. We also offer Medicare retiree health. We also offer that to our for the state plan, and we also cover the Line of Duty Act health benefits. So in aggregate, all of these plans together roughly cost about $2 billion a year. I was asked to point out the health insurance fund. I don't know if you can read that, and I'm going to have to put my glasses on for this one. The summary is that we have a fairly healthy health insurance fund balance. Going back as far as fiscal year 19, we ended the year with just over $381 million. At best, so it does fluctuate throughout the year. At one point, a couple years ago, we were roughly $563 million. Of course, each month as claims come in, it changes. The last time we pulled a balance was November of 24. At that point, we had roughly $485 million. And this would be just for the state's health insurance plan. We do have separate funds for both the local choice and the LOTA plan. And we do use fund balance to offset or subsidize employee premiums. So when we started to see an increase in the claims cost, instead of passing all of that on to our employees, many times we will actually subsidize some of those increases from the health insurance fund. So I believe you're all aware that we are currently going through a procurement for the self-insured plans and our pharmacy benefit management. Where we are, so first of all, the purpose of this, we want to ensure that we're getting the best programs at the best cost. Our current contract was a 10-year term, which is highly unusual. Typically, these are 5-year terms. And we also wanted to be more specific in the deliverables that we expect from all of our carriers. So that's why we went out for bid this year. We're also looking at potential innovative solutions such as value-based models. And this does, again, just include our 3 self-insured plans, not our 2 fully insured regional plans. So at this point, the solicitation has been completed. We've actually reviewed and scored all of the proposals. We've held interviews and negotiation meetings. And at this point, we have sent everything over to the Office of Attorney General and DGS for the high-risk review. We are hoping that just occurred within the past week or 2. They each have 30 days to conduct their review, and I believe it's 30 business days. So we are hoping to issue intent to award here as soon as those are completed. And then the last piece of information I was asked to present on was some workers' compensation data regarding PTSD. So I have a few slides. The first is just from statewide data. And so what I wanted to point out here, and I'm going to put the slides on, or glasses on again. So for the last 2 years, because we did a 2-year review, We had a total of 25 claims. 10 were accepted and 15 were denied. And you can see we've paid just under $395,000. We do have reserves of $718,000 and incurred just over $1.1 million. So then looking specifically at those that fall under the presumptions, we only had 3 claims within that 2-year period that fell under the presumptions. And you can see here what has been paid for both medical and indemnity. Hopefully you can read that. Medical, just under $5,400. Indemnity, $88,000. We do have reserves of about $6,200 for medical, $24,000 for indemnity, and then incurred reserves for medical, $11,000, almost $600, and indemnity, $112,668. And we also had, the last legislative session, there was a request for us to look at PTSD claims by localities. And so we worked with Workers' Compensation Commission to pull this data. And what we found was for that same 2-year period, there were a total of 716 claims. The average cost for these claims was $792.15. But one of the questions we were asked to look at was how many claims exceeded the 52-week maximum for payments. And there was only one that we can confirm was paid beyond the 52 weeks. And I will also point out the data that we were provided did not separate those presumption claims from other PTSD claims. So I'm going to wrap up with some key messages. Whoops, I went too fast, I'm sorry. So on our workforce, attracting and retaining talent is always a critical ongoing issue, and we're always looking for innovative ways to attract more individuals to the Commonwealth. Our mid-level to higher-level professionals and managers seem to be the most difficult. Turnover, again, slightly increased, and voluntary resignations in the first 5 years remain significant. And workforce planning and knowledge transfer is always one of our biggest concerns, is making sure when we have those retirements, especially our long-term retirements, that we have time to transfer as much knowledge as possible. On the compensation side, again, we have the 3% a salary adjustment that is projected for, I believe, June 10th or July 1st of this year. This will, again, hopefully help us reduce the lag that we have with the private sector. Again, reminding you about the minimum wage increase and the FLSA exempt threshold that is on hold. And again, reviewing our 25-year statewide classification salary structure and our biennial compensation review, which we are looking forward to beginning here in the next couple of months. And with that, I'm happy to take any questions you may have.
Jan, thank you so much. Any questions for the director? I had one question going back to retention, and then folks actually do leave. Are agencies required as a standard practice to do exit interviews or surveys?
So, Chairman Willett, exit interviews are not mandatory, but they are encouraged. And there are 2 methods for conducting exit interviews. So most of our staff, especially full-time staff, when they're exiting and we're receiving their ID badges and the equipment, have an opportunity to provide more of an informal exit survey. When employees actually leave, and it's not even just leaving state service, we have employees that will transfer between one agency and another, and that's considered a separation for that agency. They will be emailed a link to our exit survey that is conducted through Mercer. Now, again, it's voluntary, so the participation, we're not exactly, I could probably find out how many actually complete that. I have also been informed that some agencies have created their own exit surveys in addition to the Mercer survey. So.
Great, thank you for that.
You're welcome.
I don't see any other questions, so I'm going to thank you again. Super informative presentation, and let's keep those state employees happy.
Well, thank you for the opportunity.
Yeah, okay, good, thank you. Members of the subcommittee, that wraps up our business today. Looking at, Mike, we're going to meet on Monday?
Yeah, yes. Our normal meeting time is Monday morning. Obviously, we're busy with the governor's speech.
Yeah. All right, so we'll be back in action next week on Monday. And it's another reminder, this is a very quick turnaround this year because we basically have 2 weeks to get our business done, and then we're on to the full committee. So we'll stay on. Great. But thanks, everyone, for being here. And we're adjourned.